Hi guys, it's Chris. I'm doing a quick video. It's been 4 weeks today since I had my orthodontic surgery. I'm just doing a video to show people what to expect, give them an insight into what they're going to be going through if you're getting this kind of surgery, and possibly try and answer a few questions that they might have. So I'll start off with the surgery itself. Now, I went in on the Wednesday, the 12th of November. I had the operation done the 13th of November. I went down, when you go in on the 12th to take your blood, they'll go through a few things with you and that, and they'll make sure that you don't, after a certain time, eat anything or drink anything. So then on the Thursday, when I went down, the operation took 6 hours. I was in recovery then for a further 2 hours. When you come round, my God, it ain't pleasant at all. I was sweating bucket loads. I'd swallowed a load of blood, so I was throwing up a lot of blood and that, and also I wasn't breathing properly, so I had an oxygen mask on. So expect not to be in the best of ways when you come round. For the first 2 nights I had to have somebody sit by my bed and watch over me, because I was still throwing up blood and stuff like that. So, but after that, day by day, you get better. Pain wise, now if anybody's thinking of getting this operation done and they're scared about pain, thinking, well, I don't know, it's gonna hurt, it's gonna be well painful. Pain is nothing to worry about. It is quite a painless operation. If you feel any pain at all, they'll be giving you painkillers and stuff, so you just ask for a painkiller and it'll take pain away. I got a bit of aching. That's all I got, just a little bit of aching, which then gives you a headache. So, I asked for a painkiller and it took it away. Now, it's 4 weeks since I've had the operation. If I start talking too much, I might get a little bit of aching, but it's really nothing. So, don't worry about pain, please. Swelling, when I had the operation, the first day I wasn't that swollen, but then the day after I got a bit bigger, and the day after a bit bigger, and I ended up, my cheeks were massive. If you can imagine Craig David out of Ball Selector, that's how bad I was. It really was bad. That's quite unpleasant, this swelling, especially when you've got your mouth wide together and your plastic splinting. Now, your plastic splint I actually have with me, because I asked my surgeon when he took it out 2 weeks after the op, he took the plastic splint out, and when he did take the plastic splint out, I says, can I actually keep the plastic splint? And I sort of got a couple of funny looks, and they're like, well, what do you want to keep that for? It's disgusting. I says, well, I want to show people on YouTube what it looks like. So here we are. This is what you'll basically have in your mouth. Before the operation, they take some mould of your teeth, and then they make this, and basically it's got the grooves of your teeth where your teeth will sit, and then your teeth are wired together, sitting on that basically. So that there will hold your jaws in position so that they don't move anywhere. So yeah, you have that in for 2 weeks. That's quite a mouthful itself. Eating's difficult. You're going to be eating soup, basically. Soup, and it sucks. I was watching people in the ward eating pizzas, eating curries, and I was like, oh, I'd kill for a curry or a pizza, man. You know what I mean? It really does suck having to eat soup. When I went in, I weighed 11 stone. When I came out of hospital, I'd lost pretty much a stone. I now weigh 9 stone 12. But I'm eating a bit better now, I can open my mouth a little bit more. I've got just 2 elastic bands in now, if you can see. I can pretty much get a fork up there now. So as long as I don't chew anything, I can just swallow it, get it down. I'm alright, there's no problem. So eating's difficult. Also, your surgeon might have told you, if you're going to have this operation, that your nose, there's a chance that it'll flare out a little bit. Now, he said that to me, and personally, before I went in for this operation, I'd broken my nose anyway, so it was quite wide, and I was like, I don't want it to get any wider. He says, well, what we'll do is, if it gets wider, we'll just pinch it a little bit. So I ended up having to do that. I ended up having to pinch it a little bit, and then that, because he pinched it a little bit, I had these like paper things, really long, like if you can imagine like a paper towel sort of thing going all the way to the back of your head. Now, please, I must say that is the most unpleasant thing. When they pull them out, that is the worst thing about this whole surgery. They said to me, I was wired up to morphine in case I was in a bit of pain, which I didn't actually use the morphine in itself because, you know, it's quite a painless operation. But they said if you feel any pain, just take a couple of blasts of this morphine. But when they come round, they said we're going to be taking them things out your nose now. So I was like, right, we'll take a couple of shots of that morphine because it's going to be a bit unpleasant. And now I know why. I know why they said that, because it is the most unpleasant feeling ever. You know, coming from all the way from the back of your head, pulling them out. Glad I don't have to go through that again. So yeah, your nose, you might have to have it pinched a little bit. Now, on the profile view, which I'll show you in a minute, my nose does look smaller from what it was. I don't know if I did a profile view on the other two videos, but my nose is on the profile view looking smaller. It looks the same pretty much this view, but anyway, I'll show you a profile view now. So yeah, that's me. Personally, I'm really happy with the results. You know, I'm really chuffed. I've got another probably 2 weeks now to keep these elastic bands in, then I can take them out and probably start chewing softer things. So yeah, if anybody's got any questions or anything, you know, keep them coming. Keep the questions coming. I'll try and answer them. I hope I've covered everything. I think I have done. Oh, numbness, have I mentioned numbness? Numbness, they might tell you about, you know, you're going to be numb. The surgeon said to me, he said, 40% of my patients are like permanently numb somewhere on the face. Now, after the operation, I must say, I had the tiniest, and I mean the tiniest bit of numbness, just there, like a little dot on my chin. That went within 2 days, and other than that, I felt no numbness at all, which is brilliant for myself, I must say, it really is. The surgeon, I told the surgeon, and he says, you know, it's very rare that I have somebody that's not numb. He says, but to be fair, when we did the operation, we didn't come across any nerves or see any nerves, so, you know, it's all good. So that's something I'm delighted with again too. So yeah, if you've got any questions, keep them coming. If you're waiting around for the operation, keep on keeping on, you know, it'll come around sooner than what you think. So see you guys soon.